This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello, everyone. This is Andy Southerland from the University of Virginia. And for this week's Neurology podcast, I'm really excited to be speaking with my friend and colleague, Amy Hessler, for the latest installment in our Physician as Patient series. This series carries over from our April 22 Neurology Recall series, as well as recent interviews with colleagues Franzi Herpich and Joe Servin about their own experiences as neurologists dealing with neurological disease. I should also point out that some of you may have attended the annual meeting on Tuesday, April the 16th, where we did a live on stage interview with Dr. Hessler and colleagues about this for the Neurology Podcast and Publications featured section at the annual meeting. So a little bit about Amy, I'll share. She and I worked together on the American Academy of Neurology's Education Committee. She spent a good portion of her career at the University of Kentucky as the Neurology Clerkship Director and a general neurologist there. She now practices in Jacksonville, Florida, where she specializes in both headache and also has an interest in women's issues in neurology, for which she does work as well. So, Amy, thanks so much for joining us for this latest installment of the Physician as Patient series.
Thanks for having me, Andy.
As our audience knows, we always give a little bit of a preamble to why you're here talking about yourself as a patient. I'll say a very little bit, and then we'll look forward to hearing your perspective. But just as way of background, as I understand it, Amy, you were at the young age of 12, I believe, when you suffered a intracerebral hemorrhage from a ruptured arteriovenous malformation, or AVM. Were treated at that time. We'll hear a little bit about that at one of our academic institutions. And then again, as a neurology resident, had a second hemorrhage or brain bleed from that AVM, which we'll look forward to hearing about how that shaped you and how you recovered from that. But tell us a little bit about that, particularly, again, going to the time when you were a neurology resident, sort of the surreal nature of both being a neurologist in training and then all of a sudden being a neurologic patient again. Share that with us.
So what happened when I was 12 was I was in a friend's pool and I came up under a slide and I hit my head and I developed diplopia and dizziness and nausea and vomiting. The friend's grandmother called my mom, and actually I was taken to a local hospital. I have those notes. It's actually kind of funny that I have those notes. They watched me and observed me. And again, this is 1986. They observed me. They didn't do any scans at that time. They discharged me. I was still ataxic. They discharged me. And then the next day, they brought me back for an EEG and a CT. So the EEG was fine. The CT actually showed that I had a left cerebellar hemispheric bleed. So they actually readmitted me, transferred me to a bigger institution in Tampa, Florida, which is where I grew up. And I had an angiogram, and they found that I had an AVM that was fed by the superior cerebellar artery. Now, obviously, I understand that more in retrospect, didn't it? When I was 12, a neurosurgeon saw me, decided it was too deep to operate on, and it was too dangerous. It sat on the middle cerebellar peduncle. So actually, several months later, I actually was referred to Mass General, and at Mass General did an angiogram again and decided that I was a candidate for proton beam therapy. So I actually had proton beam therapy. My mother still tells the story of me locking myself in the bathroom and deciding I wasn't going to do this as a cantankerous 12-year-old. And when she uses my middle name, I know that I'm in trouble. So Amy Beth came out, and actually I was treated, and this is so ironic that I was treated in the basement of Harvard, Andy. And I had general anesthesia. I had my halo placed. They told me, this adolescent girl, that I wasn't going to have any scars. I still have little marks left, but they told me everything was going to be fine. I was actually put back in a yellow cab, sent back to Mass General. I was throwing up in the yellow cab on the way back and actually recovered and actually had no deficits. But then fast forward, of course, to my second year of neurology residency. So I was a neurology resident at Tufts, and this was 2004. And I was actually going to do a neuroradiology rotation in several months. And I thought, oh, well, this will be good to see the status of my AVM. 2 months before my rotation, I actually had another bleed. So I was in a gas station. I had one of my attendings from another hospital that said hi to me. I hadn't seen him in a couple of months. He left, and all of a sudden I got dizziness, and I felt like I got hit with a sledgehammer in the back of the head. I'm sitting in my car. Thankfully, I wasn't driving. Sitting in my car, I actually called a friend, another physician who was down the street, and I said, I bled again. I need my head in a scanner. I started taking my jewelry off in the car. And the friend came, the gas station attendant called EMS. I got taken to Brigham and Women's Hospital, admitted to the ICU. Actually, I remember they waking me up because I was working out a lot and my heart rate went down into the 40s. And so they were waking me up because I was bradycardic. And then two of my attendings, Alan Roper and Tom Sabin. Tom Sabin just passed away a few months ago, but they came to my bedside and said, Amy, just stick your toe up. And I said, Dr. Roper, I don't want to have a hemicraniotomy. So anyway, they decided that I was going to be a good candidate for a repeat of proton beam therapy. I was actually out of my training program for 3 months. I went back home with my mom to Tampa. Then I came back a couple months later. The funny part about Boston, my theory on Boston is no one leaves Boston. They just change hospitals because parking's so difficult, is what I've always said. So I come back to Boston for my evaluation at Mass General. And this older physician is in charge of the proton beam program. Well, I am telling him this story. So actually, Alan Roper had gotten all my records from 1986 when I was treated. And actually, the famous Raymond Adams actually saw me as a patient and referred to me as a bright 13-year-old in 1986. And actually, Chris Ogilvie, who now, 2004, is the chairman of neurosurgery, was actually in 86 a neurosurgery resident rotating with Dr. Adams, and he's the one who wrote my admission note. And so I have these notes. So when he came in the room, he asked this Dr. Chapman, well, does she look familiar? Of course, this is like 23 years later that he's seeing me. And, Dr. Ogilvie's like rushing out of the operating room. He's the chair of neurosurgery. How many thousands of patients has he seen since 1986 when he was a neurosurgery resident? So he goes, no, she's just on my list of patients to see today with you. So anyway, we kind of laughed about that. And I was treated in 2004 with proton beam therapy again, and then returned to my training program.
That's a story rich both in your own personal experience with it, but also rich in the history of particularly vascular neurology. As a vascular neurologist, that's fascinating to hear. I'm looking across my desk right now at Adams and Victor, the textbook that was off referenced during my training. And so to have Raymond Adams refer to you as a bright 13-year-old, that's quite a credit, Amy, and feathering your cap from that time. So one quick question about that period of time in your youth and your adolescence and then leading to medical school. So you went into neurology, obviously medical school and the neurology residency, knowing that you had this event and this AVM. Were you being monitored or serially imaged during that time? You mentioned amusingly you were looking forward to neuroradiology rotation to assess the status of your AVM. What was your mindset about the AVM during that time?
I actually wasn't being followed because I completely recovered those plasticity of the adolescent brain. I had no deficits. I wasn't followed. I really didn't know the status of my AVM. As I went into med school, I obviously learned what an AVM was. I remember my mom. So my mom's a physical therapist. And I remember in 86, her saying, I took Xanax for a couple of days because she had been told, I could have had an aneurysm, or obviously when you get told your 12-year-old had a cerebellar hemorrhage, that's pretty scary. So I really hadn't been followed, but I was completely normal. In high school, I played volleyball, I played basketball. I really didn't have any deficits, didn't really think about it. That's why I kind of knew as I learned about through med school, in neuroscience, okay, I guess I have this thing in my head, but it's not causing me any problems. So I'm sure my mom put it on my pediatric records that I had this bleed, but I was lost to follow-up, as we say, I guess.
Did this influence your interest in neurology specifically, or was it just simply a coincidence that you had this as part of your history prior to that?
People ask me, is that why you went into neurology? And so I always wanted to be a doctor. So none of my baby dolls in the 70s were ever healthy. They were always sick. My mom has a picture on her dresser of me with my Dorothy Hamill haircut in the 70s, taking care like with a thermometer in my baby doll's mouth. So my mom's always been my inspiration, and she was a physical therapist. So I actually worked as a candy striper in the hospital in the 80s. So I always wanted to go in and become a physician. I didn't know what field. Like many of us, had went through and internal medicine, GI, cardiology. I went through all different types of things. And I actually started out doing an internal medicine residency. I was at Geisinger Medical Center, and I did a combined AOA, ACGME, as I'm a DO internship in Pennsylvania. That's where I met my husband, who was a surgical resident at that time. I say that we fell in love over a Peters tube. I know, that's like crazy, like silly doctor humor. And then with my history of my AVM, I think it made me interested in what was going on with my own body and interested in that. But I did actually start out in internal medicine. And then it was through a neurology rotation during internal medicine that I actually decided I wanted to do neurology. So I took an elective and went to Tufts and did an elective, and there was an open spot to join their PGY2 class. So I joined their PGY2 class.
That's just a amazing story from your time as an adolescent all the way up to your time during neurology residency. Now, I guess I want to touch on briefly, what sounds to me like a fairly rapid recovery to be able to re-enter your neurology residency training within a few months of this cerebellar hemorrhage and repeat proton beam therapy. So one thing we like to ask in this series is just about the recovery itself and perhaps carrying over from the hospitalization and so forth. Are there lessons that you feel like you can share with neurologists in practice, particularly our students and trainees, about helping patients through that very difficult time of recovery, and then what maybe helped you recover so rapidly to be able to jump right back into residency training?
My deficits is, I actually didn't even know this concept until I had it myself, is I had pretty profound oscillopsia. So actually trying to get the words on a page of something I was trying to read to stay still took so much energy after my bleed that by the time I concentrated and got them to stay still, it was just, I couldn't read well because of the oscillopsia. So that gradually improved. And I still do actually have some mild deficits. I know that to my left, I have some coarse nystagmus. So if somebody comes over my left shoulder, I oftentimes close my left eye and I look monocularly at them. If I get really tired, I get a little ataxic. So, I was seeing patients at Tufts in Chinatown and 2:00 in the morning when all of us as residents get pulled out of bed to go see a neurologic emergency or consults in the ER. Here comes the stumbling, neurology resident, not having any alcohol on board or anything. And I still notice, Andy, and I'm sure you as a vascular neurologist had patients tell you this, that I do get really tired. I was trying to do something. I had a webinar earlier this week, and by about 9:00 after a full day, I just really noticed the tiredness and fatigue. Kind of thought about things that I think is important to share with trainees, and lessons that I've learned and I've thought a lot about is that I think it's really important that you're aware that you really don't know what patients' lived experiences have been, what their other stressors that they might have going on, potentially they're not sharing everything. I can tell people that I've had this bleed, but how it's affected me. And I think jumping to conclusions, we need to be cautious. I see that with trainees over the years of, especially being a clerkship director and training neurology residents, that what jumps out the most to me is FND diagnoses and jumping to conclusions. And I really think it's important not to jump to conclusions. So I think that's one important thing. And actually, after my stroke, I went through a period of depression. I realized when I was in resident clinic in Kentucky that I could tell if a neurology resident, as they asked that question about depression, if they'd ever gone through a bad time, because it can be very dismissive, like, oh, have you ever had depression? Oh, you're on antidepressant medications. And if you've not gone through that, I think it's coming to the forefront, especially since all of us have gone through this with COVID. But really mental health is such an important factor and plays into neurologic disease. And we need to be aware of that because that really does affect a lot of our neurologic patients. And then this one, just thinking about it, like as I started after my AVM, thinking about family planning, I actually had it treated, and actually the nidus and my AVM with the proton beam completely resolved. But I was thinking about how my husband and I wanted to have kids, and could I have a vaginal delivery versus a C-section? And when you're reading literature and studies, there's a very small chance of recurrence of bleed, but that's a big risk. I actually chose to have a primary C-section with my deliveries for the reason because I had the AVM, because I didn't want to risk, even though as a neurologist, although I'm an N of 1, we can look at small percentages, but something as catastrophic of having another bleed, I made that medical decision for myself, knowing that the stakes were so high and I didn't want to although it was a single-digit chance of me having another bleed, that was like potentially life-altering if I had another bleed.
I think that's a great lesson right there. Again, as a vascular neurologist, we're often trying to guide patients and advise them based on what the greatest proportion or odds of a certain outcome are. Whereas if you're the patient, it's much more apparent that even a single 1% chance or 0.1% chance that still is an N of someone. And so it affects you disproportionately than perhaps we consider it sometimes based on the preponderance of data or evidence. So I think it's important for us to recognize that when we're talking with patients about their options and that sort of shared decision-making process. So thanks for sharing that, Amy. There's so much we can learn, and you're so forthcoming in bringing us into this experience with you, and both the good, the bad, and as you point out, even some of the humorous things that thankfully you can look back on now. I'm amazed at you and your recovery and all you've accomplished, of course. But is there anything else that you'd like to share about this experience that's helped shape your perspective as a neurologist?
Try to put yourself in the shoes of your patient. We, as physicians and providers, this is our job day in and day out, but this is a new experience for the patient. And laying in that hospital bed is a very vulnerable place to be. And I had a medical student in with me, or two medical students, and she said, I don't want to be a guinea pig. So even though we are educators and we're trying to educate the next generation of physicians, I think it's really important to put yourself in the shoes of your patient. And one thing is, sometimes we don't have all the answers. In neurology, we have to be okay sometimes in living in these shades of gray. But being kind, and we can always offer kindness to our patients, and sometimes the gift of our time. And I know that doesn't, we can't, billing and how much time we spent and whatever, but this is our calling as neurologists and our professional mission in our life's work, and the gift of our time and our kindness is a big gift to patients.
Well, I think that's a great lesson to end on, and we could expound on that, of course, but I think it's a simple and important message in this day and age when there's a lot of talk about how AI will assume a lot of both the cognitive and the technical things that we do as physicians. Those aspects that you point out, Amy, of remembering to be giving of our time and to be kind to our patients, that was actually a lesson that the originator of this podcast, one of my mentors, Ted Burns, talked quite a bit about. So it's wonderful to hear you share that today as a predicate of your experience as a patient. I've really enjoyed talking with you, as I always do. And you can find this podcast, as others, in this Physician as Patient series, and carrying over from our live on stage interviews at the annual meeting. I'll simply say, Amy, thank you so much for joining us and for sharing your experience, and good luck with all the great work you're doing in neurology, both locally and abroad.
Thanks, Andy. I really had fun sharing with you today.
Dr. Adams was correct, as he often was. So, all right. Well, thanks everyone for listening.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.